की डालना पड़ेगा लगता है, देख लीजिए। Hi. So hello to all of you. Just one moment. So hi बच्चों. So last time we had seen the posterior triangle of the neck. Remember? आज देखते हैं anterior triangle of the neck. So welcome to one shot series, PW Meded special series for you all students. One shot series of anatomy. ठीक है, start करते हैं anterior triangle of the neck. ठीक, चलो let us start. Like posterior triangle में हमने वो diagram draw किया था, याद है? We had drawn a diagram for the posterior triangle. You remember the same diagram I'm drawing here? Try to understand this. You should practice drawing such diagrams. Okay. Look at this. So what's this process? What's this process? That's a mastoid process. Mastoid process. What is this muscle? Answer this if you are if you can answer this. Yes. What is this muscle? Sternocleidomastoid. Correct. What is this muscle? That's a trapezius. Trapezius. What is this going to be? This is the body of the mandible. That's the ramus of the mandible. The body of the mandible, the ramus of the mandible. What is this junction known as? ये junction को क्या बोलते हैं? Angle of the mandible. Angle, right? Hi, Aman. So that's the body, that's the ramus, that's the angle of the mandible. ये क्या होगा? This is the midline of the neck. This is the midline of the neck. What's here? The clavicle. That's the clavicle. We draw an imaginary line from the angle to the mastoid process. एक imaginary line draw करते हैं. So this becomes the side of the neck. This we have seen in the posterior triangle. याद है? हाँ, very good. Amina. So midline of the neck, trapezius, body of the mandible, line drawn from the angle to the mastoid, clavicle. Now this neck is divided into two triangles by sternocleidomastoid. ये है anterior triangle, ये है posterior triangle. Right, you know this. अब what is this bone? ये bone का नाम बताओ. That's the hyoid bone. Hyoid bone. And what is this muscle? ये क्या muscle होगा? This is the omohyoid. Omohyoid. What is this belly? Inferior belly of omohyoid. What is this belly? ये belly कौन है? Superior belly of omohyoid. Correct? So that's the superior belly. That's the inferior belly of omohyoid. The inferior belly divides the posterior triangle into further two triangles. बोलो बच्चों. ये शफीक, अमन, अमीना, बोलो. What were those two parts, the two sub-triangles of the posterior triangle? Posterior triangle के दो sub-triangles होते हैं. What is this and what is this? This is the occipital triangle and ये होगा supraclavicular triangle. The occipital and the supraclavicular triangle. Correct? Okay, I draw one more muscle here. एक और muscle है जिसके दो bellies होती है. Can anyone guess this? This is the digastric. Digastric. So ये क्या belly है? That's the anterior belly of digastric. What is this belly? That's a posterior belly of digastric. Anterior belly, posterior belly of digastric. Now this is the anterior triangle of the neck. Anterior triangle के काफी सारे triangles होते हैं. There are plenty of triangles in the anterior triangle. एक बार वापस muscles देख लो. This is the superior belly of omohyoid. That's the inferior belly of omohyoid. Anterior belly of digastric. Label करो क्या? I'll label this. Okay. So that's the anterior belly of digastric. Fine. What is this? That's a posterior belly of digastric. Posterior belly of digastric. What is this muscle? ये क्या है? This one. That's a superior belly of omohyoid. And what's this? Inferior belly of omohyoid. Perfect. Now tell me, बहुत सारे triangles मिलते हैं यहाँ पे. Tell me, this is triangle number 1, that's number 2, that's number 3, and that's number 4. अब चार triangles बनते हैं यहाँ पे. Subdivisions of anterior triangle. Yes, good evening, Bhavish. So what are the subdivisions of the anterior triangle? Look at this. See this triangle. ये triangle देखिए. What are the boundaries of this triangle? ये कौन है? That's the midline of the neck. That's the superior belly of omohyoid, and that's the sternocleidomastoid. Correct? The midline of the neck, the superior belly of omohyoid, and the sternocleidomastoid. In this triangle, we get only muscles, muscles, and muscles. यहाँ पे muscles होते हैं. Now, these muscles look like a belt. हाँ, hi, भावेश, hi. एक मिनट. हाँ, very good. ठीक है भावेश, just listen to this, बाद में discuss करते हैं. So this muscles यहाँ पे in this triangle looks like a belt. Belt की तरह होते हैं. This is what we call as the strap muscles, right? So in this triangle we get only muscles, muscles and muscles. So what is this triangle? इसको क्या बोलोगे? Number one is the muscular triangle. Muscular triangle. Anatomy nursing के लिए भी है भावेश, ठीक है? So ये triangle आप देख रहे हो, this is the midline of the neck, that's the superior belly of omohyoid, that's the sternocleidomastoid. ये triangle है muscular triangle, perfect है. See this number 2, इसके boundaries देखिए बच्चों, you get MCQs on the boundaries of this triangle, right? So just remember this. What is this now? That's a posterior belly of digastric, that's the sternocleidomastoid, and that's the superior belly of omohyoid. The superior belly of omohyoid, the sternocleidomastoid, the posterior belly of digastric. Now in this triangle, the common carotid artery comes here. The common carotid artery divides into two terminal branches, the external and internal carotid. And external carotid gives branches here in the head and neck. So this number 2 is known as the carotid triangle. Carotid triangle, ठीक है? So what are the boundaries of carotid triangle? एक बार वापस देख लो, ये हमेशा आता है MCQs में, Vivas में. Boundaries. So the posterior belly of digastric, the sternocleidomastoid, the superior belly of omohyoid. So that's the carotid triangle. Perfect है? Look at this triangle. ये triangle देखिए. The anterior belly of digastric, the posterior belly of digastric, and the body of the mandible. Here, यहाँ पे होता है ये. यहाँ पे gland है. There's a gland here. That's a submandibular gland. And this triangle is therefore known as the digastric triangle. इसका नाम क्या है? This triangle is the digastric triangle. Digastric triangle. Fine. What are the boundaries of digastric triangle? Anterior belly, posterior belly of digastric, the body of the mandible. That's the digastric triangle. Very good to all of you. And now come to this last triangle number 4, the midline of the neck, the anterior belly of digastric, and the hyoid bone. It's just below the chin. ये chin के नीचे होता है. This is what we call as the submental triangle. Submental triangle. Submental triangle. So this is the submental triangle. Perfect, bachcho? Huh? Very good. Just have a look at this now. Have a look at this. The same thing, same slide. Just identify this muscles. If you can identify this, number 1, okay, number 2, number 3, number 4, number 5. Chalo, bachcho. Just try to identify this muscles. Come on. Come on. Koof. What's your name? Yes, chalo, bachcho. Just try to identify this number 1. Yes, number 1 is the sternocleidomastoid. Yes. Number 2 कौन है? Superior belly of omohyoid. That's the inferior belly of omohyoid. That's the anterior belly of digastric. That's the posterior belly of digastric. Fine. Now triangles के नाम बताओ. This is triangle number 1. This is triangle number 2. This is 3, and this is 4. Chalo, what is this triangle number 1? That's the muscular triangle. You can see this muscles here. Hi. सौरव चैटर्जी हाय. हाँ, डाइगेस्ट्रिक के पास 2 ग्लैंड्स होते हैं, द सबमैंडिबुलर ग्लैंड एंड आगे होता है सबलिंगुअल ग्लैंड. यस, बनाता हो फुल सीरीज बनाता हो, ठीक है. सो दिस इज द मस्कुलर ट्रायंगल. व्हाट इज दिस नंबर 2 ट्रायंगल? द कैरोटिड ट्रायंगल. What is this number 3? The digastric triangle. And what is this number 4? The submental triangle. Submental triangle. बच्चों समझ में आया? Clear to all of you, the triangles of the neck, the anterior triangle, the subdivisions of the anterior triangle. I'm sure. What should be the structure of answer? बच्चे generally है ना, triangles, muscular triangle comes as a short note. Muscular triangle आता है short note. Posterior triangle comes as an LAQ. वो last lecture में हमने discuss किया है posterior triangle. Now इसमें muscular triangle comes as a SCQ. We are seeing the muscular triangle. मैं muscular triangle बोलता हूँ आपको, ठीक है. So this is the muscular triangle. Just look at this muscles, बच्चों. These are the muscles in the muscular triangle. चलो, can anyone tell me? from the sternum to the hyoid bone. Look at this number 1 muscle. ये number 1 कौन है? Sternum से लेके hyoid bone तक नाम sternohyoid. This is sternohyoid. Sternohyoid. From the sternum to the thyroid. ये thyroid cartilage है. From the sternum to the thyroid. What is that? Sternothyroid. Sternothyroid muscle. Sternothyroid muscle. Number 3. From the thyroid to the hyoid. Thyroid से लेके hyoid तक. What is this? This is the thyrohyoid. Thyrohyoid muscle. And that's number 4. Number 4 is the omohyoid. Omohyoid. ठीक है बच्चों? क्या डिस्कस करें? What are we discussing? Muscular triangle. Muscular triangle के boundaries, you know the boundaries of muscular triangle. Muscular triangle के boundaries. This is the superior belly of omohyoid, the sternocleidomastoid, the midline of the neck. Muscular triangle में what are we going to get? The muscles. And this muscles look like a belt. ये belt की तरह होता है. These are known as the strap muscles, right? Strap muscles. Which are these muscles? Number 1, from the sternum to the hyoid, sternohyoid. From the sternum to the thyroid, sternothyroid. From the thyroid to the hyoid, thyrohyoid. And what's number 4? The omohyoid. Omohyoid. Perfect. So these are the muscles in the muscular triangle. Muscular triangle के ये muscles है. अब बच्चों, what is important here? What is the nerve supply of this muscles? What is the nerve supply of this muscles? एक loop होती है, loop. A loop is known as Ansa. Ansa is a loop, and this loop is found in the neck. Ansa cervicalis. Ansa cervicalis. So what is the nerve supply of this muscles? Ansa cervicalis. But what is Ansa cervicalis? How it is formed? What it supplies? Let us understand the Ansa cervicalis. Okay, ये discuss कर रहे हैं अपन. Clear बच्चों? We are discussing muscular triangle. Muscular triangle के contents I have told you, the muscles I have told you. अब देखते हैं इनका nerve supply of this muscles. ठीक है? Now try to understand. Ansa is a loop. ऐसे loop है. Ansa मतलब loop. And to form this loop, we need 2 nerves. 2 nerves चाहिए अपने पास. So this is one nerve. This is one nerve. ये दोनों join होंगे. That is a loop. Fine. So look at this. This is one nerve. This is one nerve. And now they join. And ये बन गया loop. This loop is what we call as Ansa cervicalis. अब ये कैसे form होता है? I'll start. Just try to understand. बहुत important है. बहुत important है. Fine. Okay. I'm starting. Now, this is the nerve which is going to supply the tongue. बोल सकते हो, which is the nerve supplying the tongue? Which is the nerve which goes to supply the tongue? The hypoglossal nerve. Hypoglossal nerve, that's going to supply the tongue. These are the fibers of C1, C2 and C3. ये C1 spinal nerve है, C2 spinal nerve, C3 spinal nerve. Okay, now I'll start. Just try to listen to this, understand this. Fibers of C1, जो C1 के fibers है, they go with the hypoglossal nerve. Okay, so I'm C1, that's the hypoglossal nerve. So C1 बोलता है I'm coming with you. Okay, the fibers of C1 they go with the hypoglossal nerve for a short distance. थोड़ा सा distance तक जाते हैं. After that they leave the nerve. Now they say you go. तू जा अपने रास्ते. I'll not come with you. So fibers of C1 they go with the hypoglossal nerve for a short distance. Now they leave the nerve as number 1. What is this branch? This is the meningeal branch. Meningeal branch of C1. That's meningeal branch of C1. Second is nerve 2, thyrohyoid and geniohyoid. Nerve 2, thyroid and geniohyoid. समझ में आ रहा है? So fibers of C1 जो है, they go with the hypoglossal nerve short distance. After a short distance, they leave the nerve as number 1, the meningeal branch. Number 2 is the nerve to thyrohyoid and geniohyoid. And जो तीसरा branch होता है ना, the third branch, that descends down. ये नीचे descend होता है. So this is what we call as the descending hypoglossi. Or this is what we call as the superior root of Ansa cervicalis. The superior root of Ansa cervicalis. So superior root of Ansa cervicalis कहाँ से आया? Where does it come from? C1. Once again. fibers of C1 spinal nerve, they go with the hypoglossal nerve. They first go with the hypoglossal nerve. एक थोड़ा सा distance के बाद they leave the nerve. अब बोलते हैं I'm not coming with you. Okay, it gives 3 branches. Number 1 goes to supply the meninges. नाम है meningeal branch. The second branch goes to supply the thyrohyoid and geniohyoid muscles. And the third branch is descending down from the hypoglossal nerve. This is what we call as the descending hypoglossi, or the superior root of Ansa cervicalis. The superior root of Ansa cervicalis. Fine. Now, C2, C3. यहाँ पे देखिए, this is C2 and C3. They join together to form a nerve. This is known as the descending cervicalis. Descending cervicalis, or this is what we call as the inferior root of Ansa cervicalis. Inferior root of Ansa cervicalis. तो ये inferior root आ गया ऐसे, and that's the superior root ऐसे, and what's this? That's the Ansa cervicalis. ये बन गया अपना Ansa cervicalis. समझ में आ रहा है बच्चों? Are you able to follow? Yes, Saurabh? Are you able to follow, all of you? Yes, बोलो बोलो बोलो, समझ में आ रहा है? Ansa cervicalis बेसिकली क्या है? लूप है. ये लूप कैसे बनता है? 2 नर्व्स से बनता है. 2 नर्व्स कहां से आए? एक C1 से आ गया, दैट्स सुपीरियर रूट ऑफ Ansa cervicalis. एक C2 C3 से आ गया, दैट्स inferior root of Ansa cervicalis. Both of this joins to form the Ansa cervicalis. This is a short note. इसको बोलते हैं Ansa. What is that? Ansa cervicalis. That's Ansa cervicalis. Fine. And we get branches from this Ansa. यहाँ से branches आएंगे. This is nerve to sternothyroid. This is sternohyoid. Sternothyroid, sternohyoid. This is the superior belly of omohyoid. And that's the inferior belly of omohyoid. So that's how the Ansa cervicalis is formed. And what are the branches from the Ansa? The nerve to sternohyoid, sternothyroid, superior belly of omohyoid, and inferior belly of omohyoid. Perfect है बच्चों, समझ में आ रहा है? Hi radiology. Okay, very good, very good. So this is what is Ansa cervicalis, and this Ansa cervicalis is going to supply the strap muscles. Strap muscles कौन से होते हैं? These are the strap muscles. ये strap muscles है sternohyoid, sternothyroid, thyrohyoid, and omohyoid. अब बोलो बच्चों, all the strap muscles are supplied by Ansa cervicalis except, चलो, can you answer this? All the strap muscles are supplied by Ansa cervicalis except, that's a very, very, very important MCQ. Except. Answer this. Come on, come on, come on, come on. All the strap muscles are supplied by Ansa cervicalis except एक strap muscle है जिसे Ansa supply नहीं करता है. There's one strap muscle which is not supplied by Ansa cervicalis. What is that? चलो बच्चों, बोलो बोलो बोलो. I'm listening. I'm waiting for your answer. Yes, any guesses? That's a thyrohyoid. Look at this. That's a thyrohyoid. ये देख रहे हो? Thyrohyoid. Thyrohyoid is a strap muscle है ना? ये strap muscle है thyrohyoid. ये thyrohyoid कहाँ पे होता है? Muscular triangle में होता है. But thyrohyoid is supplied by whom? It is supplied directly by C1. C1. अगर MCQ आता है nerve supply of thyrohyoid, your answer is going to be C1. Which is the other muscle supplied by C1? Geniohyoid. जो दूसरा muscle है, that's a geniohyoid, which is supplied by C1. Perfect है? Now this Ansa cervicalis lies on a sheath. आप यहाँ पे palpate करिए. Just palpate here, deep inside. Just deep to the sternocleidomastoid. Feel करिए. What are you feeling? What are you feeling? Anyone? What are you feeling deep to the sternocleidomastoid? What are you feeling here? That's the carotid artery, the common carotid artery. Now this common carotid artery is along with a big vein. बोल सकते हो? Come on बच्चों, answer करो ना. You can answer. You be interactive, no? You be interactive, so it's easy for me. It's easy for you. Okay, this common carotid artery is along with a vein. What is that vein? Any guesses? So I'll just draw this. ये देखो, ये मैंने draw किया common carotid artery. and this continues as internal carotid artery. That's a common carotid artery. Fine. What is this big vein? That's an internal jugular vein. यहाँ पे एक nerve होती है, nerve. What's this nerve? Vagus nerve. Vagus nerve. And all this is present inside a sheath. ये sheath के अंदर होता है. What's this sheath known as? Any guesses? What is the sheath known as? That's the carotid sheath. This is what we call as the carotid sheath. Yes, very good, Ganesh. So, what are the contents of carotid sheath? अगर MCQ या फिर Viva में पूछते हैं contents of carotid sheath, what students say? So, the contents of carotid sheath are common carotid artery, internal jugular vein, vagus nerve. But there's something else also. The common carotid artery, ये कौन सी ब्रांच है जो शीथ से बाहर गई? That's the external carotid artery, goes outside the sheath. So what continues inside the sheath? Internal carotid artery. Fine. So अगर contents of carotid sheath पूछता है, so your answer is common carotid artery and internal carotid artery, the internal jugular vein and the vagus nerve. Vagus nerve. हाँ, ये है the main contents of the carotid sheath. The common and the internal carotid artery. इसको याद रखना. Common and internal carotid. What happens to the external? The external carotid will pierce the carotid sheath and go out. ये बाहर चली जाएगी. Now, on the anterior wall of carotid sheath, ये carotid sheath हो गया. On the anterior wall of carotid sheath, what lies? On the anterior wall of carotid sheath, what lies is a loop like this. And what is this loop? The Ansa Cervicalis. Ansa Cervicalis, समझ में आया बच्चों? So ये जो Ansa हमने draw किया है, this Ansa Cervicalis lies on the anterior wall of carotid sheath. ये याद रखना. Very good, Ganesh. So Ansa Cervicalis lies on what? The anterior. Ansa Cervicalis lies on the anterior wall of carotid sheath. तो बच्चों आज हमने क्या पढ़ा है? We have studied the anterior triangle of the neck. ठीक है? The subdivisions of anterior triangle, muscular triangle के boundaries, carotid triangle, digastric triangle and submental triangle के boundaries हमने पढ़ा. Then we studied the contents of muscular triangle, the muscles. कौन से muscles है? Sternohyoid, sternothyroid, thyrohyoid and omohyoid. And इसके बाद हमने पढ़ा Ansa Cervicalis, the nerve supply of this muscles of the muscular triangle. That's Ansa Cervicalis. Fine. That's the nerve supply of this muscles, Ansa Cervicalis. So Ansa Cervicalis lies on the anterior wall of carotid sheath. Ansa Cervicalis supplies all the muscles except thyrohyoid. Perfect है? Perfect है बच्चे? Clear? So now I'll just tell you the branches of external carotid. हाँ, common carotid artery की कोई branch नहीं होती है. Internal carotid artery, no, does not give any branch in the neck. Internal carotid is the main artery supplying the brain. Internal carotid बोलते हैं I will not give any branches in the neck. No, my territory is inside the skull. मैं skull के अंदर जाने के बाद I will give branches, right? So remember, internal carotid artery gives no branch in the neck. So who's going to supply this head and neck? The external carotid artery. External carotid artery is going to supply the head and neck. Perfect. So let us understand the branches of external carotid artery. Okay, that's fine. So branches of external carotid artery. So that's a way to answer this. अच्छे से आंसर करना है आपको वाइवा में. See, वाइवा is always a comparison. मेरे पास दो बच्चे आते हैं, एक को मैं पूछता हूँ, tell me the branches of external carotid. The student says, sir, I know anterior branches, posterior branches, medial branch, terminal branch. And then elaborate करता है. दूसरा बच्चा बोलता है, sir, lingual artery, superior thyroid, ऐसे randomly. You have to be very systematic, very much planned and thorough in answering in the Viva. Only then you get good marks. So what are the branches of external carotid? I know, sir. Let me tell you. Number one. Roman number one. ऐसे बोलना है branches of external carotid artery. Roman number one. Anterior branches. Anterior branches में A. The first anterior branch is superior thyroid. Superior thyroid. Superior thyroid artery. Superior thyroid artery. Second is lingual artery. Third is facial. facial artery. Facial artery कहाँ पे feel करते हो? Anterior border of sternocleidomastoid. You know this. Anterior border of sternocleidomastoid. Oh, I'm so sorry. Anterior border of masseter. I'm so sorry. Anterior border of masseter, not sternocleidomastoid. But that's common carotid. Anterior border of masseter पे क्या feel करते हो? Facial artery. Okay. Slip of tongue. Fine. So I know branches of external carotid. Anterior branches. The superior thyroid, the lingual, the facial. Then coming to two posterior branches. Posterior branches are posterior auricular, and occipital. Posterior auricular and occipital. ये posterior branches हो गए. Then Roman number 3, medial branch. Medial branch. Medial branch एक ही होती है medial branch. That's ascending pharyngeal artery. Ascending pharyngeal artery. And last is Roman number 4, terminal branches. Terminal branches are given in the parotid gland. The external carotid artery enters the parotid gland and gives two terminal branches. एक सीधे ऊपर जाती है. Oh, my head is spinning. As you can feel an artery here. Which is that artery? Yo. Guess. Superficial temporal. And which is this artery? Maxillary. Right. So terminal branches are superficial temporal and maxillary. Superficial temporal and maxillary. बस ये याद रखना है आपको. Just remember this. So branches of external carotid, sir, I know. Anterior branches, superior thyroid, lingual, facial. Posterior branches, posterior auricular, occipital. The medial branch, ascending pharyngeal. And the last two terminal branches given in the parotid gland, the superficial temporal and maxillary. So these are the branches of external carotid. Lesser occipital नहीं है बच्चे. Lesser occipital is a nerve. Lesser occipital nerve होती है. Lesser occipital artery नहीं होते. There's an occipital artery, there's an occipital artery. हाँ. Hi. Yes. Lectures है YouTube पे. Good. ये occipital artery comes in the posterior triangle of the neck. Fine. Lesser occipital nerve होती है बच्चे. Artery नहीं होती है. Lesser occipital is a nerve. Understanding? Clear है सबको? So बस ये आंसर करना है आपको. Be very clear बच्चों. Be very clear when you're answering in the Viva. Be confident. Stand in front of the examiner. Greet the examiner. Good morning or जो भी है good afternoon. And then you answer the questions. Okay. And be confident. Look at in the eyes of the examiner and answer. Don't look down and answer. Fine? ठीक है? And be confident. अगर नहीं आता है तो then you say I'm not able to recollect. Fine? क्या यू आस्किंग मी अबाउट रेडियोलॉजी? पूछ रहे हो क्या? यूट्यूब पे है, लेक्चर्स है. देयर आर लेक्चर्स. यस, लेक्चर्स तो है, आप देख लो. जस्ट हैव अ लुक एट दोस लेक्चर्स. बी कॉन्फिडेंट. एंड सपोज इफ यू आर नॉट एबल टू आंसर, इफ यू आर नॉट एबल टू, अगर कुछ नहीं भी आता है, सो डोंट टेल दैट आई डोंट नो. ठीक है, बस ये बोलना है सर आई एम नॉट एबल टू रिकलेक्ट राइट नाउ. दैट्स फाइन. ठीक है ना? यू नीड नॉट नो एवरीथिंग. फाइन. बट बेसिक चीजें आनी चाहिए. बेसिक्स शुड बी क्लियर. बेसिक्स हैज टू बी क्लियर. फाइन. और कुछ डाउट्स है बच्चों? सो दिस इज अबाउट द एंटीरियर ट्रायंगल. दिस इज अबाउट द आंसर सर्वाइकलिस. बहुत 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 इंपॉर्टेंट टॉपिक है. रेडियोलॉजी क्लियर ना? आई होप योर डाउट इज आंसर्ड. आई होप योर डाउट इज आंसर्ड. कुछ डाउट्स है किसी को तो बोलो. एनीवन हैज एनी डाउट्स बच्चों? यस गणेश, कीगन, जरित. Any doubts? Anyone has? So ऐसे छोटे छोटे टॉपिक्स हैं, वन शॉट टॉपिक्स ऑफ एनाटॉमी. वी विल डिस्कस एवरी मंडे. इंपॉर्टेंट टॉपिक्स हम डिस्कस करते हैं. लास्ट टाइम हमने पोस्टीरियर ट्रायंगल ऑफ नेक भी डिस्कस किया. सो टुडे वी डिस्कस द एंटीरियर ट्रायंगल, द मस्कुलर ट्रायंगल. टू बी वेरी स्पेसिफिक, वी डिस्कस द ब्रांचेस ऑफ एक्सटर्नल कैरोटिड आर्टरी. कुछ डाउट्स है किसी को तो पूछ लो. ओके, तो ऐसे इंपॉर्टेंट टॉपिक्स विल डिस्कस. नीट यूट्यूब वाला कुछ समझ? सुमित, पढ़ लो, अभी नीट यूजी इज कमिंग क्लोज, एक ही महीना है, May 3rd is the exam. बस पढ़ो पढ़ो पढ़ो, there's no other thing, you just have to read, पढ़ो and then you come here, ठीक है, then you come to the first year MBBS. ठीक है, सुमित पढ़ लो, क्या करूँ, you just have to study. Okay बच्चों, fine, thank you so much, thank you for your patient listening, and keep watching one shot series of anatomy, especially from the PW Med team, especially for you. Thank you. See you next Monday once again with a new topic of one shot series. Thank you.